If you want to be in the position where you can ace your medical school interviews, then the first step to doing that is actually learning the content that is required from you so you can answer confidently in your med school interviews. In this video, we're going to be covering the NHS hot topic of euthanasia and assisted dying. This is a really key topic that often has come up in the news a lot, so it's really important that you understand everything about it, and that's exactly what we're going to be covering in this video. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position. But fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140. And I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalized support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalized, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. Let's start off by taking a look at the definition of euthanasia and assisted suicide, as these are different terms, and it's really important that you understand the difference between all of these different definitions. Active euthanasia is when the person deliberately intervenes in order to help someone end their life. Passive euthanasia is when either treatment is withheld or some form of treatment is withdrawn and that person no longer has life-saving treatment, which results in their death. Voluntary euthanasia is carried out at the request of the person who dies, whilst involuntary euthanasia, this is when the person is actually not given their consent in order for this to happen. Across all types of euthanasia, the person who is actually administering this medication or helping this person end their lives is typically the physician. Now, in assisted suicide, what is happening here instead is that the physician is giving the patient who wants to end their life the means in order to be able to do so. So in assisted suicide, what is happening is that a physician might actually give the patient the certain drugs that they require in order to end their life, and the patient will take that themselves. That is what assisted suicide is. What euthanasia is instead the physician would be the one administering it. So it's really important to know the difference between the two. In euthanasia, it's the physician who's administering it. In assisted suicide, the physician provides the patient with the means to end their life. Both euthanasia and assisted suicide are illegal in the UK and are punishable by imprisonment. So when you're talking about this in your medical school interviews, make sure that you emphasize this point that it's still illegal in the UK. Now, one thing that students often make a mistake on is due to the introduction of the assisted dying bill, there's often confusion here. The assisted dying bill was created as something in order to consider and to debate the possibility of making euthanasia illegal, and I'll talk about that shortly. But currently in the UK, euthanasia is still illegal, and make sure to make this really clear in your medical school interviews and not get that confused. The assisted dying bill is something that is currently being debated, and this could actually legalize assisted suicide. Now, again, it's important to note that it's not legal, and euthanasia and assisted suicide are both still illegal. However, what has happened is the assisted dying bill has moved forward to be further debated, and it could potentially become a law. Again, however, this is unclear and has not yet happened. As part of this bill, anyone who is over the age of 18 and has a terminal illness who is expected to pass away within 6 months, they can qualify for assisted suicide. As part of this bill, what happens is that first, 2 physicians will review the patient. If it's deemed that the patient does have the capacity to be able to consent to this decision, then this patient is able to qualify in order for assisted suicide. Now, according to the bill, the way this would work is that the physician would provide the patient with the means to end their life, but the physician themselves would not be allowed to administer it. The bill states that the doctor would remain in the patient whilst they self-administer this, and they would not leave until the patient has passed away. Again, it's important to highlight that the assisted dying bill, it's still being debated, and it could be completely possible that it may or may not become a law. It's really important that from the information I've given you, you're able to talk about this in your medical school interviews and talk about the pros and cons of if this bill does or does not pass. Let's start off by taking a look at some of the arguments that are in support for legalizing euthanasia. First is the ethical principle of autonomy. Now, autonomy states that patients have the right to be able to make their own decisions as part of their healthcare. Some arguments that are in support for euthanasia state that by allowing and legalizing euthanasia, it means patients are able to decide whether or not they want this, and this gives them power over their healthcare and if they have a certain condition which they don't want to live with. It's also important to highlight that some conditions can be really debilitating, especially if they're terminal illnesses. And the principle of autonomy states that individuals should have the right to be able to make decisions. And if they have a poor quality of life and this person is not happy, they should be able to have the right to make that decision. Some patients may actually also travel to other countries in order to have euthanasia. This is because even though it's illegal in the UK, in other parts of the world, euthanasia is legal. This could be really difficult for patients because they may not be in the environment that they want to be, comfortable at home, or they may not be able to have their family around them. This is one of the arguments that is presented for why euthanasia should be legal, as it stops people from traveling abroad and being in a different setting where instead they could be passing away in a comfortable environment and dying with dignity instead. It's also important to highlight that sometimes, even if individuals don't have the money to be able to travel abroad for euthanasia, some individuals may commit suicide. However, this can be a lot more traumatizing for families and the aftermath as well. And additionally, it may not be a successful attempt, which could actually cause more harm to the patient. As a result of this, due to the trauma that could be created from this, these are some of the arguments that are in support for legalizing euthanasia. However, there are also some arguments which go against euthanasia. First is the idea that doctors could be turning into executioners. Now, what some people believe by this is that because doctors are going against the ethical principle of do no harm, because they are causing death to patients, this is actually going against the ethical pillars, and which is why they might label doctors as being as executioners. It's also important to take into consideration the mental toll that this could have on doctors, as they will have to be there whilst the patient is administering the drug. If for any reason there are any complications, this could be really traumatic for physicians, and it's really important to take into consideration their mental health. And if it is something that does become legalized, making sure that there is actually support there for doctors. So another concern is that those in vulnerable groups may actually be at more risk. For example, there may be some people who feel like a burden on their families and as a result feel forced to pick euthanasia as an option, or unfortunately there may be coercion that can occur. Additionally, it could also be used to justify euthanasia for certain groups such as those who have disabilities, and it's really important to make sure that this does not occur. So when you are talking about euthanasia, mention how that if it does become legalized, that these things do have the correct legislations and the correct regulations to make sure that this doesn't occur. But again, this is one of the reasons why euthanasia may not be a good idea to legalize. I hope this video has helped to give you a much greater understanding to what euthanasia, assisted suicide, and what the current situation in the UK is like. Additionally, I've provided you with the arguments expressed by people who do believe euthanasia should be legalized and those who do not. This means that you can use these arguments to debate them and discuss them in your medical school interview, so you can talk about them in an analytical manner. Also, don't forget to check out the rest of my YouTube videos if you want to learn about all of the hot topics to help you do well in your medical school interviews.